Well, I think that there really is a movement about elevating the patient voice. And I think about, certain words that we're hearing now that we may not have heard so much 5 years ago. One of them is sort of patient-powered research networks. There's now, at PCORI, the Patient Centers Outcomes Research Institute, has been funding these patient registries. And I bring that up because I think there is an awareness that, some of the outcomes in which many of our clinical research are based aren't always as relevant to the patient experience. Yes, you may be surviving, but I'm sick and I can't meet any of my social roles that are important to me. And so one of the ways I see a difference is, again, a real interest from diverse stakeholders now in what really matters to patients. And that ties into patient-centeredness. We hear about it. I think there's a lot more we can be doing in making sure that patients are at the table when we're having these sort of policy level conversations. One of the areas in which we're working is a number of professional organizations, such as ASCO, put out a paper in June about sort of what value, value equation. How are we going to determine value in healthcare? And in their discussion, they identify one of the limitations is they didn't have any patients at the table. And so we're actually working to make sure that to understand how do patients define value, and how can that be incorporated into some of these policy discussions about how we're going to pay for cancer care in the future.